Hello, my name is Elena Osterber, and today's discussion is going to be about medical decision-making and ethics. Next, we have integrity. Problems in maintaining integrity sometimes arise not from a lack of moral conviction or even from a conflict of moral norms, but from moral demands that require persons to sacrifice in a way that causes them to abandon their personal goals and projects. If a sister who is a nurse is the only person in the family who can properly manage her sister's healthcare prescription medications, nursing home arrangements, explanation to relatives, and negotiation with physicians, little time may be left for her personal projects and commitments. Such situations can deprive us of the liberty to structure and integrate our lives as we choose. If a person has structured his or her life around personal goals, they are ripped away by the needs and agendas of others. A loss of personal integrity occurs. Discernment. A discerning physician will see when a despairing patient needs comfort rather than privacy and vice versa. For instance, when a patient is waiting for surgery, they are often very nervous and they want comfort. They want people to be with them. They want the physician to assure them that everything is going to be okay. If comfort is the right choice, the discerning physician will find the right type and level of consolation to be helpful rather than intrusive. Conscientiousness. This is an important virtue as well. A physician's refusal to honor a patient's valid advance directive to withdraw artificial nutrition and hydration under certain circumstances. A nurse's refusal to participate in an abortion or sterilization procedure. And a pharmacist's refusal to fill a woman's prescription for an emergency contraception on the grounds of conscientious objection. Conscientious objection is not new. It's been around for a very long time. And it was especially important during wars where soldiers objected to being in war and killing. There are also, however, strong reasons to promote conscientiousness and to respect conscience on the other hand. Some conscientious refusals adversely affect patients and others' legitimate interests. Public policies, the professions, and institutions should seek to recognize and accommodate conscientious refusals as long as they do so without seriously compromising patients' rights and interests. Deontology. The most important aspects of our lives are governed by certain unbreakable moral rules. The key to remember with deontology is that these are moral rules. Immanuel Kant is the one that developed this theory, and he called it a theory of duty, or obligation, holding that some features of actions other than or in addition to consequences, such as utilitarianism, makes actions right or wrong. One must act not only in accordance with, but for the sake of obligation. To have moral worth, a person's motive for acting must come from a recognition that he or she intends that which is known to be morally required. There's also the categorical imperative to consider. Immoral actions must not produce universal law. In other words, what if everyone performed the action? That is the measure. So is there duty or obligation to act? It is deeply rooted in theology, and the Ten Commandments are one of the things that are considered the unbreakable moral rules. For example, at Cook County Hospital in Chicago, 2 youngsters, they're around 12 or 13 years old, were fired upon by a drive-by shooting. Both youngsters had injuries as a result of gunshot wounds. These youngsters were only about 200 yards from the front door of the emergency room at the time of the shooting. Emergency room personnel, in fear that they would be shot, did not seek to assist the 2 youngsters. If the ER personnel were acting on the basis as a duty to act, they would have risked their lives to save the children. What is life? Let's look at the sanctity of life. This argument points out strong religious and secular traditions that all life should be valued. The sanctity of life is limited to the biology of an organism. We talk about this particular topic in ethics in terms of abortion or embryo research, cloning, genetic engineering, even euthanasia and stem cell research. The sanctity of life is a concept that one believes in. It is a moral conviction. It is about how humans should be treated. Humans meaning all humans, regardless of their stage of existence, their quality of existence, their type of human diversity, and encompasses every possible quality of relationship. An example of utilitarianism can be seen in government. Some good examples include the annual flu shot programs and mass vaccinations. Mass vaccinations and flu shots promote public health and creates herd immunity. The negative side effects, however, of vaccination and flu shots outweigh the beneficial effects. Utilitarianism is essentially a consequence-based theory, but is also beneficence-based. Policies and laws that are utilitarian include the right to an abortion, physician-assisted suicide in the states of Oregon, Washington, and Montana, Medicare and Medicaid. What are some of the policies in your life that are utilitarian? Let's think of public school, driver's license, having health insurance. The question is, what good and bad consequences will probably result from this action in this circumstance?